everyone, and welcome to the Femme Force Podcast. My name is Rachel Pasquan, and I am your host. And today I am so excited to be joined by Dr. Dona, who is a triple board certified psychiatrist specializing in perinatal and reproductive mental health, which I think is a huge thing right now. And I think it's going to be really pertinent to a lot of different women. So this is going to be focused on mental health challenges in pregnancy and postpartum and the importance of personal care. So thank you so much, Dr. Donna, for being here. If you could tell everyone just a little bit about yourself and your specialty.
Sure. Well, thank you so much for having me. I'm so excited to be here as well, too. So, my name is Dr. Donna. I'm a child, adolescent, adult perinatal psychiatrist, and I'm also board certified in obesity medicine. So I have my hats in many different fields, but I truly love and enjoy what I do. I have a private practice in Riverview, Florida, but I'm also licensed to see in several states, such as all throughout the state of Florida, New York, Pennsylvania, and Washington, D.C. So that's where my practice primarily sees patients.
That's amazing. And what inspired you to have this specialization? It's very niche.
Yeah, so I will say my journey is pretty multifold in that I always knew I wanted to be a doctor. So my father is a physician as well. So it was always something in the back of my head. I originally considered going into neurosurgery just because I was always very interested in the brain and the complexities of the brain. But then as I got older and realized, okay, the training is forever and ever, and the lifestyle maybe isn't conducive to me wanting to live the life I want, and that I'm probably going to have to be available for surgeries and working very, very long hours, like that type of thing. I redirected my focus, but then I actually got into psychiatry when I was in medical school and I was doing my rotations. In medical school, you will typically go through all the different specialties, like exposure in at least every specialty, to get some training background in it. And I would notice that basically in all of my rotations, I would want to be spending extra time with people, like wanting to know their background, their history. And then when I actually got into my psychiatry rotation, I was like, okay, this fits and this makes sense because that was the aspect of it that I always enjoyed, like getting to know people on a deeper level, a deeper meaning. So that's how I got into psychiatry. And then, so I did my general psychiatry residency, and then I knew I wanted to be able to see more. I've always enjoyed child adolescent population, so then I did my subspecialty training in child adolescent psychiatry as well. And then when I actually decided to pursue perinatal psychiatry was after I'd finished both my adult general psychiatry training and child adolescent. And then I just realized, the female population, as much as we address them in general psychiatry, perinatal psychiatry in particular, women of reproductive age, postpartum, everything in between. It's a focus, but it's not like a huge focus. And there's so many more nuances in it that was where I've always wanted to learn more about it. And then unfortunately, when I kind of went through struggles myself when it came to fertility, that was just another kind of driving factor for me to want to continue to expand my education and knowledge when it came to treating the perinatal psychiatry population in general.
Which I find so interesting because I feel like nowadays people, we share mostly everything on social media all the time and share so
Mhm.
our lives. And a lot of women are sharing their struggles with fertility and their struggles with, getting pregnant or the after portion of pregnant. And I've never been pregnant, but my friends who have done it, I keep my hats to them all the time because it's phenomenal to literally grow a human, deliver a human, and then raise said human or
Yeah.
human. So
hmm
what do you think took so long to get this specialty on board, like with women's health, especially?
So I'm going to say, as much as I do appreciate people being more willing, able to talk about these issues, like during pregnancy, childbirth, parenthood, even just a few years ago, I think there definitely was still more of a stigma about being open and honest about talking about having struggles or having issues with these things. And I will say, honestly, sometimes too, nowadays, people will still try to put best foot forward, like, idealized lives and those types of things. But I think that the shift in okay, no, everything is not sunshine and rainbows all the time. There are significant concerns, especially during this time period in particular. That is when this field became, yeah, just a more focal point on, okay, these women, it's not just general psychiatry, but hormone fluctuations, all of these different things can affect women in so many different ways when they are in this time period in their lives. And that's where I think they decided, okay, we need to have more education. We need to have more training on this specifically. And I will say in general, as a psychiatrist, while we have come a long way, unfortunately, I do still see the stigma when it comes to mental health in general, people being hesitant to talk about these things. So while there are more people who are open to talk about it, there are still so many people who are still so scared and hesitant to talk about it. And I think that was also something that pushed me to really want to continue training my education and explore this and to continue to be an advocate for mental health in general, just because a lot of times when people are going through difficult things, they think that they're alone, but honestly, they're not. And so many people go through these struggles. And I think bringing this to light, bringing more education and more awareness that there are people who are able to help when people are going through these struggles, especially perinatal reproductive path, that they can get help and that they should.
I mean, I can't even imagine the challenges that you must go through. Number one, just being pregnant. So the toll it has on you, from like mood swings to anxiety to I've seen things about like having OCD after, and like just like, this repetitive fear of doom that things are not going to turn out great, and like your anxiety heightens and your hormones are all over the place. So how does
Yeah.
this, like, really affect like the mental health, all the hormones, the physical, like all of this?
Yeah. So during well, one thing is a lot of times I'll come even before the perinatal period, I'll have women of reproductive age come to me and they'll be like, "Oh, I'm mostly okay for the month," but then the week or two before my period, all of a sudden I'm like completely hormonal, or like I'm completely down or completely anxious, like I can't function the way I used to. And then I'm like, okay, like, well, they usually haven't identified it that it is the week or two before their period, but I'll usually ask, okay, yeah, like does this kind of happen around the same time every month? Are your cycles pretty regular? And then we'll kind of pinpoint, oh, wait, no, this can actually be due to my cycle. And the reason that this happens is because of the huge hormone fluctuation the week or two before cycle. So estrogen, progesterone. So that is a thing that is ongoing, even outside of like pregnancy, postpartum era. But then you can imagine huge influxes of hormone changes, dysregulation during pregnancy, childbirth, postpartum, all of the above. And yeah, it's a known fact that like estrogen, progesterone, all of these hormonal fluctuations can definitely impact mood, well-being, energy levels, all of the above. And yeah, I think it is just people being able to recognize, hey, it's not just something is wrong with them, it's actually something physiologic going on with their body that can contribute to the extreme anxiety, the extreme depression, etc. Like all of the things that can happen when it comes to these huge changes going on in someone's body during this time period in particular.
What's the impact if this is untreated? Like if for both the parent and the child, what can
Yeah.
happen if we're not really paying attention, or you just don't know that this is something that can be helped?
Yeah, so I'm going to say the impact can be huge. So a lot of times people come to me kind of aware that they have something going on, but they're hesitant when it comes to either treatment or medication. So I'm a huge advocate for, so I'm a psychiatrist. I prescribe medicines, but I'm a huge advocate for behavioral interventions, therapy, just because prior to meds, because, while obviously I can see and I have seen the benefits of medicine, I really think people need a multifold approach, and sometimes people do well with getting extra support, whether it's talking with a therapist on a regular basis, becoming insightful of their symptoms and what's going on with them, identifying their triggers to what and different coping skills that they can do to manage those things specifically. And then it's typically when someone has done all of these things and then they're still not feeling better, or there's some improvement, but it's still impairing their lives. And that's honestly when it comes to me and prescribing medicine, when it comes to actual impairment of someone's life, that would lead me to actually say, hey, I think that you would benefit from taking a medicine. And I know there are a lot of concerns when it comes to taking a medication during pregnancy, and that's always going to be a conversation to be had. But all of the evidence will show that the risks versus benefits of treatment from both behavioral and a medication standpoint for women during pregnancy and the child is going to be greater untreated versus not treated. Like all the evidence is there, just because not only the hormonal fluctuations, but the stress that can happen, increased cortisol levels. If someone is undergoing a lot of depression or anxiety, that might lead to them not engaging in their prenatal care as best as they can, taking care of themselves, eating, sleeping, all of the above, which is all obviously going to be detrimental to mom and baby during this time period. So the evidence is there. Like if there is something going on, hey, you should definitely see someone to just see. Like I think being open to exploring, understanding something is going on. Yes, it might be scary to potentially reach out for help, but there are people who have probably gone through something similar that you have gone through, and that there is help out there. And it doesn't mean you're weak. It doesn't mean something's wrong with you for wanting to seek support and help. It just means that you might need extra support during this time, exploring what that is, and then, taking steps from there to try to see what can be done to help you through that time period.
I mean, big fan of therapy. We go 1 week over here and like medicated and all the things. So I'm such a huge proponent for it because it's helped me so much. And I've been, I did this one, started when I was very, very young, like 12 years old, going to see a therapist, and was bullied and all of the, all the things that like led my parents to finally, do this, but we didn't talk about it. We didn't talk about it because like it was you, and like you have a therapist. Now my favorite sentence is my therapist says. So, which is, I'm gonna get it put on a t-shirt. How people, because you don't want to like say that you think something might be wrong, or you feel like you're doing something wrong as the mother. What are some things that partners or friends could look for or see in someone to be like, maybe she's struggling?
Yeah, so partners, friends, what they could look for is all of a sudden a drastic change in someone's demeanor, their personality. Like, say someone is typically happy-go-lucky and pretty friendly, but all of a sudden they're sullen, withdrawn, isolated, and this is not just circumstance. Like, like if someone passes away, if some big life situation happens, understandable, right? But this is prolonged, like going on for an extended period of time, that it's actually impacting their activities of daily living and their daily life. So friends, people who they might have friends that they see on a regular basis, all of a sudden they stop hanging out with their friends completely. Or it might come to work where someone has typically been very involved in work, very engaged in work, but all of a sudden they're missing work, they're not going to work, they're having trouble with their performance, or even in spouses and household, like causing a lot more fights, seeming a lot more isolated, withdrawn, like just a sudden change of demeanor, seeing that they're not doing things in terms of taking care of themselves, like all of a sudden they're not eating as much, or eating way too much, or they're sleeping way too much, or not sleeping at all, because all of these things are about maintaining life. Like, so homeostasis, that's something that I'm a huge proponent for. And like all these things, like eating, sleeping, these are basic human necessities. But if one of these things is kind of out of whack, that can affect everything else. So sleep is way off, someone is appetite and nutrition is way off, that can start impacting other things. But then if these are not just, one off, like wasn't eating, or, something happened that week, but it was like, no, this has been going on for weeks, for months, and then just something does seem off within that person, I don't think there's anything wrong with a partner, a spouse, a friend to just check in with that person. Like, honestly, like people might not want to be intrusive, but I don't think there's anything wrong with just letting someone know that, hey, you care, you're thinking about them, and want to try to support them in whatever way that you can.
And I mean, it can be taboo, but I think like you have to get in there and you have to like be that friend. Being a friend is also sometimes like having the hard conversations,
Mm-hmm.
getting in there and doing that. Once they've agreed, or they're like, I feel like something is wrong, I would like to see somebody. How do you address this, like as a specific to their needs?
Got it. Yeah. So, if someone has identified, yes, that they do want to see someone, exploring what that could be, just because I will say, while people have been more open in terms of mental health, sometimes there is still that taboo, that concern, that stigma. So, if someone is more medical based, maybe even checking in with their PCP. Hey, like getting your lab work done, just making sure that your labs are okay, just because sometimes vitamin D deficiencies, iron levels, thyroid issues, they can contribute to anxiety, depression, all of the above. And then PCPs, they also do screening. Like PHQ-9 is the general depression screening questionnaire. So they will typically run those at annuals. And then they can also identify too, like if the things have been missed otherwise, and then they might be able to give referrals. So if someone is more hesitant to approach it from like a mental health standpoint, maybe approaching it from a medical, hey, see your PCP, get your annual done, just make sure everything's okay from a medical aspect. That's the route I would take. But if, say, someone is more open to behavioral health interventions, potentially touching base with a mental health counselor, like a therapist, or a licensed clinical social worker, or anyone who can provide behavioral intervention. So that would be one of the first options. And then I also recommend psychiatry too, because I will say some people are still scared when it comes to potentially meeting with a psychiatrist, because they think, oh, someone wants to automatically put me on medicine. But I'm going to say, again, me personally, and I would like to think for most psychiatrists, that's not going to be the only initial and primary thing we want to do. Like ultimately, at the end of the day, we want to help identify what someone is going through and then help them navigate what that could look like, whether that is going to be primarily behavioral interventions first, which is again what I typically will recommend, or behavioral interventions and or medicine, and then providing options from there. And then if that is scary, so I will say psychiatry can be scary, but like just being open, willing to exploring the options out there. And if people don't know where to start, even checking in with their insurance, like seeing what is covered through their insurance or not. There's Psychology Today. There's so many different platforms online. If people are more okay with doing virtual versus in person, but some people for in person. So yeah, there are so many different platforms out there today that the information is out there. It can seem scary and intimidating, but I think it's definitely worth exploring and looking for it if you are noticing that you are going through something and might need additional support.
1000%. And I think we have the resources out there. We just need to utilize them in whatever way we can. For women who are having trouble and
Yeah.
maybe more not being able to get pregnant, and like having that
Mm.
stress on them, and like the amount of pressure that they feel trying to get pregnant, and that this is the one thing they want and they can't get it. What do you suggest for that? Because that has to also affect them hormonally and a lot of other ways, just the amount of stress they're putting themselves under in their body.
Yeah, yeah. So I would also definitely suggest for a woman who is struggling with trying to get pregnant, infertility, to seek supports. And supports can come from so many different ways, whether that is, talking with, like, the basics are talking with loved ones, spouses, friends, partners, etc. But then, for more actual support when it comes to the fertility, that could come from, if they're seeing someone for the fertility issues, like an OB or a reproductive endocrinologist. And then if they might have resources in terms of therapy, like there are specific therapists who are trained in infertility, perinatal mental health, perinatal psychiatry, infertility, all of these people and all of these resources are available. Also, if you're someone who's more interested in support groups, there are support groups like forums, people who have gone through similar struggles. Because again, a lot of times when it comes to mental health things and fertility in general and infertility, so many people think that they're alone in their problems, that no one can really understand what they're going through. But then sometimes finding a community can be beneficial. So community support groups, those types of things. Or if you're wanting something on a more individual basis, looking for someone who is specially trained in fertility, infertility, for exploring from a therapeutic route.
And I think that's so smart. I just feel like there is this like unknown pressure that you don't, I mean, nobody knows what anybody's going through, as you're walking down
Yeah.
the street. We're always like, be kind, but the pressure that women are being put on themselves. And what about the partners, like, and the family that's involved in this? Do you suggest help for that? Because like it's out of their control and out of their hands, I also feel like. So like that has to feel very helpless for them at some point.
Yeah, for partners and the friends going through this, I think it's a similar approach as like for someone going through mental health struggles in general, just letting them know that they're there, that they're available, that they want to try to help them in whatever way that they can, knowing, hey, they while they might not be the ones going through it in particular, like especially, partner, spouse, someone going through the fertility journey with them, understanding that that is going to be difficult for them as well too. So if that partner needs support, potentially looking for their own support, but then just trying to be as supportive for these individuals going through this time period in general. Again, keeping an eye out if there are huge changes in terms of overall well-being, taking care of themselves, changes in demeanor, eating, sleeping, all of the above. And then really just kind of emphasizing, hey, you don't have to go through this alone, because that's the fallacy that I see all the time. And that people are like, I don't want to bother anyone. I should just be able to deal with this. Like, this isn't such a big issue. But honestly, a lot of times, so many people will diminish their own problems and try to help other people. But at the end of the day, most people are not putting themselves above anything else. And I think that's what does lead to further mental health issues, like diminishing your own needs and wants and putting other people's needs and wants above your own. So recognizing, hey, what I'm going through is hard. And it is important for me to treat myself like I would treat another loved one by getting help and support.
I mean, do you feel like partners should do this together? They should do it on an individual, or is that just based on situations?
I think it's based on situation, but I think it should always be a conversation, because at the end of the day, a partnership is a partnership, and that like there should be a compromise, there should be communication, there should be a discussion. Um, and yeah, so again, I can't say for every relationship, but I like definitely in every partnership, people should be communicating their issues. But then, say one party is struggling more than the other, that's where they themselves might need to see someone on a more individual basis, or explore their issues on their own terms. But then we'll still need to bring it back to the partnership and try to find a way to collaboratively work together.
And that makes so much sense. And for hopefully you get pregnant, you have a beautiful, healthy baby, and then the postpartum. What different types of postpartum are there? Because you hear a lot about, different things of just like the depression of it. And we've heard things about OCD that come out of it. What are some different types of postpartum that come out of having a baby?
There's so many different postpartum periods. Like, so basically, normal, what would be considered within the realm of normal is just postpartum blues, which is just like, huge hormonal fluctuations. So once you've delivered and given birth, there's a huge decrease in estrogen and progesterone specifically. So that can influence mood and cause things like postpartum blues. And that is just kind of feeling a little bit more low for the first few weeks after birth, but that can be really considered within the realm of normal for the first few weeks to the first months. Like, so some sadness, maybe some crying, but not anything to the extreme. But then there's actual postpartum depression, which goes deeper than that. It's not just some crying and sadness, but like it goes beyond that, and like maybe inability to get out of bed, maybe inability to start to be taking care of the child and themselves, whether that comes to feeding, changing, et cetera, et cetera. Thoughts of suicide, so it can get pretty severe. Then there's postpartum anxiety, like extreme anxiety about, oh, am I doing everything right for the baby? Is something going to go wrong? And that can be really impactful if it's causing limitations in terms of care, not allowing the baby to kind of do anything, not wanting to leave the house because there's so many fears around being a new parent. Yeah, so there's postpartum for basically everything, like postpartum mania, postpartum bipolar disorder, something where it's like someone might not even had bipolar or mania before, but then experience huge mood fluctuations, like impulsive, risky, dangerous behaviors that maybe someone hadn't done before pregnancy, but all of a sudden are manifesting after pregnancy and delivery. Postpartum psychosis, someone actually, and then this is unfortunate because these are things that you might hear about in the news, but like someone having actual hallucinations, psychosis, like really aggressive, extreme behaviors when it comes to themselves, how they handle their children, like delusions, those types of things. And yeah, postpartum OCD. So similar to OCD that someone would have, not even just in the postpartum period, but like um intrusive thoughts, like obsessive, obsessive thoughts and like intrusive thoughts, and then like compulsive behaviors to help manage those thoughts. So all of like basically any mental health disorder that you can have prior to pregnancy can manifest postpartum. And it's just so yeah, it's just so crazy how the human body works, and how hormonal fluctuations, physical changes, emotional changes can just affect a woman in and their mental health in the postpartum stage.
I think it's so interesting too, because I think people, and maybe just people who have not struggled or who have not sought the help, have the stigma that mental health is like it's just this one part of your brain and like it's your feelings and things like that. When it's like, no, this can really be a chemical imbalance. Like there can be things that
Yeah.
are wrong, and like you're supposed to be like this with a little bit of, the waves are going just a little bit, but they're supposed to regulate at some point, and then at sometimes they don't regulate, and like it's not for everybody.
Yeah. That is a conversation, honestly, I have all the time, and just not even in the perinatal space, but for mental health in general. And that a lot of times when people come to see me as psychiatrists prescribing medicines, it's like, oh, I never wanted to take medicines. I just wanted to do therapy. And of course, I'm a huge advocate for therapy, but sometimes with the neurochemical imbalance, right, that can come with these things, anxiety, depression, psychosis, bipolar mania, all of the above, as much as you want to try to implement the behavioral interventions, the talk therapy, the coping skills, it's just impossible for you to do. And like the analogy that I use is like, okay, premise behind anxiety and depression, for example, is a deficiency in their neurotransmitter serotonin. Um, for someone who has diabetes, like type 1 diabetes, they're insulin dependent. Okay, so would you tell someone who has diabetes and they're insulin dependent, hey, don't take insulin because it's a medicine, right? So the same principle can be applied for someone who struggles with severe debilitating mental health, and that they're doing all the things, behavioral interventions, coping skills, trying to treat it from eating, sleeping well, all of the above, but they're still having a ton of issues. That's when I'm more apt to say, hey, I really think that there is a neurochemical imbalance going on here. And that's where the medicines come into play to help balance some of the issues that you're having in terms of regulation and your brain chemistry in general. And honestly, that is where the both the behavioral interventions and the meds, I will see the most benefit for people who have been struggling for years and years and years, and then they are open to the medicines. Again, I know it is scary taking medicines, and like it's an individual approach, but that is where I honestly see it. And I'm a huge advocate for when it comes to the medicines in general, and that it's not just something is wrong with you. You need to suck it up. You need to just deal with it. But there's actually something physiologic going on with your neurochemistry and just the way that your brain is wired that is contributing to what you're experiencing.
And I think people forget like that things can happen in your life, and like everything's not always stagnant. So if something happens, like, you might have to readjust your meds. It's not always
Mhm.
so easy to just like stay on this like one set prescription for forever. There might be issues. I have friends who, go through things and they'll call just to check in, and then they're like, I just brushing my teeth was hard today. And I'm like, okay, this isn't to sound like mean. I'm like, but I'm being really honest. Like, have you talked to a doctor about like upping your prescription? And they'll be like, I didn't even think of that. And I'm like, yeah, there's nothing wrong. Like you're going through a rougher spot right now. Like there's nothing
Mhm.
wrong with that. Like talk to somebody and see what they can do for you, because sometimes it's like it can't just be the friends that are there as the therapists. Like we're not all
Yeah.
licensed.
Yeah, yeah, and I'll say this is where like I think especially friends, they can try to be as like helpful and supportive as they can be, but at the same time too, like when it comes to seeing like an actual licensed professional, like that is like a different era. Like so, I agree in that friends can be hugely supportive, just because sometimes people's insight into themselves, like, oh, I can't brush my teeth, but it's fine. I'm still going to work, so it's fine. But that's where friends, family, spouse, partners, they can be like, hey, no, there is something going on. Like you should be getting checked out. And then that is also further benefited when they do decide to see someone, whether it is a doctor or therapist, to be able to come from that approach of professional background to give additional support and knowledge. And then psychoeducation that, yeah, like life isn't stagnant. Like even medical issues, like you, a lot of times people don't stay on the same dose of insulin. They don't stay on the same dose of or same meds for migraines, etc. Like this happens in basically every other medical field. So there's no difference when it comes to psychiatry, except for unfortunately sometimes people are perception when it comes to psychiatry.
And I mean, I feel like just having that grace with yourself, but also learning self-compassion, which I think, I mean, you're not going to get the self-compassion from the medication. I feel like you're going to get that from the talking therapy portion of it.
Mhm.
That's why they have to go hand in hand.
Yeah, yeah. So I'll say as a psychiatrist, I actually do both. I will incorporate it in all of my like medication sessions, but they're shorter. But I happen to do a combination of meds and therapy. But I definitely agree in that the grace, the self-compassion, that is something that a lot of times people with long-standing mental health issues don't really have, just because a lot of times people who've been struggling for anxiety and depression, they have been going through it for years and years and years, and they've kind of adapted this way of thinking about themselves, how they interact with the universe, that has really taken a toll on themselves, their mental health. But again, and I think that this is where sometimes people can diminish their own needs, their own wants, put other people's needs above themselves, but then that can lead to further issues with mental health, resentment, poor self-esteem, worse self-care, all of the above, and the inability to want to give themselves grace or to even recognize, hey, something is wrong. I should address this because what does it matter? It's just me, like a not that important type of mentality, which is unfortunate.
I mean, and I think it's also the struggle that I hear of from different women that like finding an insurance provider, finding the right therapist. And they're like, well, I didn't like that. But I'm like, you don't have to like them. It's like
Mhm.
not fun, guys, but like you got to try it out. And then if it doesn't work, you go to someone else, like until you find that person that's like the right fit for yourself. So how do you feel like companies are doing with like giving these kind of benefits? Like I know like a lot of the tech companies are definitely forward thinking with it and like very big on the mental health, but then you have like more old school companies who are like, that's not part of
Yeah, so I'm gonna say it is very difficult. I know tech companies, like, they have been able to provide more benefits when it does come to mental health, but that isn't universal, and that is what makes it a little bit harder. Just because I think that while it has come some ways in terms of more coverage for mental health treatment, it's not all the way there, and it's not in any way ideal. So that is definitely something that I think would be better for in terms of benefits for all insurance companies to be more supportive when it comes to mental health, because sometimes they are like still categorized in different fields. So it's like, oh, we'll cover this for PCP and medical needs, but mental health like benefits might be a little bit less. And I'm like, how is that really fair? Because I still really think that mental health care is essentially still medical care, honestly, at the end of the day. And then in terms of finding someone, I will say it is incredibly difficult, but the thing is, when it comes to therapy and finding someone, the most important thing is fit and rapport and being able to want to talk to that person and feel comfortable with that person. And this is where it is hard. And I know it can be frustrating, but this is also, think about it. Like when you choose your friends, when you choose your partner, it's not someone you just find once and then it's totally easy. It is like, because this is someone who is going to be working closely with you to try to help you. And there are going to be so many people out there who are therapists, but they might not be navigating or managing what you're dealing with specifically, or, their speaking style, their communication style, what they're specialized in might not just be what you're looking for. And that's okay. Like I know it can be hard work, but I think it is definitely going to be 100% beneficial when you are able to find someone who does fit your needs and you feel like you can actually work with it and speak to, because you're going to therapy and you feel like you can't trust them or you can't talk with them, like then kind of what's the point? Like you're not going to get all the benefits from it that you could.
no, exactly. And I mean, I had a family member who would go to we're like we all go to therapy, it's great. Would go to therapy, but then be like, well, I lied to them because like I don't want to tell them like that. I'm like, I tell my therapist every like the poor woman like
Yeah, yeah.
she meant like I'm like I either think I'm her favorite client or she's like today's gonna be a day when she has me on the calendar. But like I'm like you still go through it. I'm like you don't lie, you just word vomit. I feel like half the time because the one person you can tell everything to.
Yeah, because ultimately, if you're not being honest with your therapist, or your psychiatrist, you're doing a disservice to yourself because they're going to be thinking, oh, if you're telling them I'm doing well, I'm having no issues, I'm having no anxiety, okay, this person's great. I'm not going to need to do anything, provide interventions, give them extra support because they're doing fine. Like sometimes people will read behind the lines, but also you can't expect people to be mind readers either. And if you're literally telling them, hey, I'm doing well, it's not their fault if they are, not able to see between the lines.
Exactly. People aren't clairvoyant, and I think people like
Yeah,
forget like that they should automatically do that, or they're gonna automatically put me on a medication. And it's like they're not gonna do that unless you need it. And
you
so,
tell them. Yeah, definitely.
do you have any tips or tricks for people who are, a little bit worried about seeking out mental health services, or like looking for somebody specific in, perinatal or in postpartum care?
Yeah, sir. Tips or tricks. So if someone is completely naive to exploring mental health, this is where I would totally go with talking with people you actually trust, friends, family, loved ones, if they've had any experiences with mental health in general, just because obviously these people are close and a trusted resource already. So gathering their opinions, even though they might be scared, I think that this is where anyone in your life who is close to you would want to try to help or support you in whatever way they can. And then outside of friends, family, loved ones, just even knowing there are a ton of resources out there, but even again, just going through PCP, like just checking in because PCPs, they can start medicines if needed, but then they also have ability to give referrals to therapists if there are people within the same network, within the same vicinity, et cetera, et cetera. But if not wanting to go through PCP like doctor route, like just even researching on your own, like looking online, like I can identify off the top of my head like multiple like resources like in terms of trying to find a therapist in your area, virtual versus in person. If you're looking for virtual, so many therapists do virtual nowadays that I don't think there would be any problem in finding someone. I guess the only limiting factor would potentially be if it isn't accepted by your insurance. But that's where you might have to just do more digging when it comes to looking into your insurance, like what is covered and what your insurance is and deductibles. Because one thing I have noticed, it's the beginning of the year, a lot of people's deductibles have reset, so they have a bigger responsibility in terms of copay for finances. So that can be a stressor as well too. And just know, like none of this is easy. This is all pretty intimidating, and for people, especially in the perinatal age, outside of OB appointments, people, perinatal psychiatry age, they're typically healthy. Like some people have medical issues, but typically healthy, not really seeing a doctor or seeing someone on a regular basis. So that again normalizes why it might feel so weird or intimidating because you're not used to needing to find a doctor unless you really needed to or needing to find a therapist. So yes, this is a process and it does take time, but it is ultimately worth it for you to kind of look and see what information, what resources are out there, what you'd be interested in if you wanted to see someone virtually, if you wanted to see someone in person, if you're considering medications. And then like if someone has a family mental health history, especially like nuclear family, like if you know mom or dad definitely struggles with anxiety, depression, bipolar, et cetera, et cetera, genetics are a huge thing that come into play just because that would also be an indicator of like if mom or dad is on medicines, the likelihood of you benefiting from both med and therapy combination is going to be higher. And then if mom and dad have done are on their own share of medicines, they've probably been through exploring different mental health or behavioral health routes, so they could be an additional support or given able to give more information when it comes to that too.
This is such good advice. And I think I'm hoping somebody, if anybody feels like they need that kind of help, like you go and you talk to someone and you try to find it. And now a little bit about you. You've done a lot of school to get into this and to be
Mhm.
in this. When you were doing all of this, is this what you thought? You're like, I'm gonna go in for this. This is where I see like the greatest need.
Like, so yeah, well, in school, I was kind of just, I knew I wanted to do something that I felt passionate about, that I wanted to do, that invigorated me, that I enjoyed doing, just because. So this mental health, behavioral health is hard work. Like, obviously the people that I'm seeing, they're struggling a lot of times, really severe depression, anxiety, OCD, bipolar, mood disorders, like grief, bereavement, all of the above. But me, it's hard work, but at the end of the day, I feel like it's ultimately worth it. Just the ability to be able to help people, to advocate for them, advocate for their needs, let them know that they're not alone, that there are options out there in terms of treatment, whether it is behavioral interventions, different types of therapy, different types of medicines, different types of behavioral supports, and trying to be a trusted ally. Just because a lot of times, especially for a younger population, I'm the only like a medical professional that anyone has seen for some time. So I will oftentimes do routine blood work when I am initiating a medicine, and we'll find, oh, like someone's thyroid level is a little bit elevated. So I'll actually find medical issues that can be contributing to their mental health issues. So going into it, I knew it was something that I wanted to do long term, that gave me happiness and gave me joy. And I will say honestly, I've never regretted the decision. Like I definitely enjoy what I do. It definitely is a difficult profession in terms of being able to be mentally strong, and it is a lot of hard work. But I will say it has definitely been worthwhile. I think all the schooling is needed, right? Just because you want to make sure that when you're talking with someone about medicines and treatment for these pretty serious things, that you know what you're doing and you know what you're talking about too. So if anyone is ever interested in pursuing psychiatry, like therapy, like yeah, psychiatry, child adolescent psychiatry, perinatal psychiatry, yes, it was a lot of school, but I definitely think it was worth it, and that I enjoy my job and I love what I do every day, and I can see myself doing it for years and years and years. And like I'm gonna say honestly too, I have a lot of friends and family that they're kind of just like, oh yeah, like my job's okay, I like it, but at the end of the day, it's just a job. Yeah. And I will say, yes, it is a job, but it gives me a lot of joy. It is something that I feel like I'm a huge advocate for in terms of wellness and empowering other people to fight stigma against mental health, and just letting people know that help is out there. Seek help early if you can. Like, don't just wait until you feel like you're struggling. Like, there are people out there who want to try to help you, but you have to be willing to want to start to help yourself first. And that's how the whole process gets started.
No, and I mean, and it has to be so rewarding because you can literally
Mhm.
the work that you're doing and like the benefit that it's giving to people. That has to be really, really special.
Yeah, yeah. Like I will say, having my own private practice, it's hard work. Like, and I'm gonna say, well, honestly, the hardest work is probably like business aspect of it, because obviously you don't go to medical school like to run a business, but that's just kind of like part of it. But the business aspect I don't like, but seeing the patients, seeing people reap the benefits, even when they're going through a hard time. Yes, it is hard for me because I feel for them, because I care about all of my patients, but then I also like to see it as a challenge. Okay, well, what can I learn from this? What can I carry from this moving forward? What can I do to be a better doctor, to be a better physician, to be a better advocate, therapist, whatever, for my patients moving forward from this?
No, I mean, congratulations, because
Yeah.
what you're doing is great. Like the work that you put into it, like all of this is just phenomenal. So for a final question I like to ask, which, this is probably some kind of psychological thing here, but if you could give one piece of advice to your 16-year-old self, what would that be?
Hmm. Uh, One piece of advice that I think I would give to my 16-year-old self is I would say that there will be many things in life that you wish that you could change, but ultimately, all of the experiences, everything that you've been through in life will shape who you are and the person that you're going to be. So you take everything as a learning experience and a data point, and that you will make the right decisions. Yes, it will be a long-winded road. Yes, that there'll be many hurdles along the way, but you will be able to do it. You will be able to be successful. You will be able to do anything that you put your mind to. You just have to be willing to put in the work to get there.
No, that's amazing. And I mean, I think you've done that. So congratulations. That's awesome. So tell the listeners, shamelessly plug where they can find you, Instagram, LinkedIn, all the things.
Sure. So, my website is www.donawellnessclinic.com. So Donna is my last name, Dona, wellnessclinic.com. Instagram, like Facebook, Instagram, and all of them are the same, like facebook.com/Donna Wellness Clinic, Instagram.com/Donna Wellness Clinic. I have a YouTube page, which actually has 50 plus videos on mental health and wellness, like longer form videos that talk about ADHD, different disorders, different treatment. The current series I'm doing is talking about different food that can be helpful for different mood disorders. Like the one I just did yesterday was talking about different foods that can help supplement for ADHD, difficulty with concentrating. So if you're interested at all in more information on mental health, wellness, ways to help yourself behaviorally, whether it is medication, non-medication based, interested in about learning more about psychiatric issues or disorders in general, that is where I'm basically throwing all my information and knowledge out there for everyone to look at. So,
I mean, it's gonna hit somebody. That's what I always think, even when I do these podcasts. I'm like, just helps one person, or one person takes something from this. Like that'll be great for me. Like that's
yeah.
great. Thank you so much for taking the time and coming on and talking to everybody. Like, I hope if anybody is needing any help out there, you go to your friends, you listen to this, and you seek the help that you deserve to have, because we all deserve to have somebody to talk to and have the right to figure out what's going on with ourselves inside and out.
Yeah, yeah, definitely. I agree. And I'm going to say, I know it's scary. Like all the stuff, mental health and all the things that you're going through or could be going through is scary and intimidating. But just know, like, it is also incredibly powerful for you to kind of recognize, hey, I am going through this, but I do deserve to feel better or get help from here. And that is the first step. And I'm going to say the hardest step in terms of receiving treatment. And then once you've decided that, I think that's where it will all become better for you if you are struggling with one of these things specifically.
Exactly. Nope. And I'm, excited to see what this year holds for everybody. And hopefully we can all get the love and the help that we need. So thank
Definitely.
you, Donna. I appreciate it. And everyone, we will see you next week.